Hi everyone, happy Friday. This is Dr. Aimee Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick.
And we are coming to you from our backyard. We're taking a day off. We had our wedding anniversary this week.
Happy anniversary.
Happy anniversary. So we thought it would be a nice time we're not going to take a break necessarily from coronavirus, but we're going to kind of pivot and talk a little bit about direct primary care and its financial benefits when it comes to this large scope of this pandemic and the sequelae that we've seen and the fallout from significant job loss and financial burdens that a lot of people are suffering right now from this pandemic, from the shutdown. We have, what's our unemployment rate at right now?
20-30%. Is it that high? I don't know the actual number, but it's high, and people have lost their jobs. And when you lose your job, a lot of times people lose their health insurance along with it. And so it's kind of like, from a medical standpoint, a double whammy. Now you don't have an income coming in, and if you get sick, you potentially have nowhere to go that you used to go where your insurance paid for it.
Right. And for better or for worse in this country, that's how we access healthcare. Is we typically, a large majority of us, get it through employer-sponsored plans. But that's not your only option. And what I like to tell people that, once you sort of break out of that paradigm and realize that you're not stuck and you have other options, you start to really free yourself and look at your whole life differently. And maybe you can take a different career path, or maybe this layoff could have been a blessing if you realize that there are other options for you when it comes to getting benefits. For me, we decided to make the leap. I decided to make the leap into DPC, and you from a business perspective, because it really did help people financially.
Right.
It wasn't like a typical concierge model where you're charging thousands of dollars a year and billing insurance and creating this two-tiered system of care. The monthly payments are very affordable. So the way direct primary care can really help people in a situation where they've either lost benefits or they find themselves maybe in a high deductible plan, and so it's really expensive for them to go see their primary care doctor, is that we take insurances, no insurance, we get direct pay from the patient. So the monthly membership fee is a wraparound fee. It covers every visit, every telephone call, every text message, every email, and that $89 a month really starts to add up in terms of cost benefit to the patient when they start to realize that we're not nickel and diming them for everything that we do, like a lot of insurance-based practices do.
Yeah, I think the light bulb for me when we had initially looked into direct primary care was that you could get cheaper care but higher quality care than you've ever gotten before. That you could pay $89 a month for an adult or $39 a month for a child and have more access to your doctor than you ever did before, and conversely have better care because of it. And that was awesome. And to me, and I think to us, we feel like this is really the future of medicine, almost a revolution in terms of, let's not rely on the insurance-based models that have driven the cost of healthcare through the roof. Let's get the patient back with the doctor, cut the insurance middleman out of it, and bring medicine back to what it should be, which is a relationship between the patient and the doctor.
Right. And we definitely have a primary care crisis on our hands. When you think about the pandemic and the people that get really sick from the coronavirus, it's people with underlying chronic medical conditions. And that could be something as simple as just strict hypertension or diabetes, and then you add to that layer that they're not controlled, so maybe they haven't seen a primary care doctor in several years, so they have undiagnosed. 2/3 of people walking around with hypertension right now are undiagnosed. They get coronavirus, they get really sick because there's that vascular damage that's been happening for so long. So we need primary care access, and direct primary care removes all of that extra bureaucratic layer. You need a primary care doctor and you just call them. And you call us if you're a member, and you don't have to get things authorized, pre-approved. You don't get surprise bills. It's all transparent. That's the other aim of direct primary care. Lab pricing is very transparent. Radiology pricing is transparent. This is the way primary care does not need to be an expensive venture. And we have in our culture, in our country, we have absolutely ruined primary care access because we've made it unaffordable
Right.
for people.
I mean, and let's real quickly touch on the fact that if you lost your job, if you lost your health insurance, we're here to help both financially and medically. And we're willing to talk to you about the financial piece. And there might be other options that make more sense for you financially. For us, we're with a cost sharing plan called Sedera. And that is not traditional insurance, although it works very similar, but it's much less expensive. So, for example, we have a family of 5, the 2 of us and 3 children, and we pay $500 a month for the 5 of us for this Sedera plan. A similar plan with traditional insurance, like my colleague at the emergency department has, is $1,800 a month. And so that is significant savings. So if you're looking for something else, if you're trying to save money when it comes to, your health coverage, your health insurance, or you just recently lost a job and lost your insurance, reach out.
Absolutely. I love talking about these things with people at no cost even. We're here for you. I'm happy to sit and have coffee with you. These are really tough times, and you're not stuck. You don't have to go on Cobra and pay 25 times the amount it actually costs.
Yeah, that's crazy.
You don't have to take the job that you didn't want to take, move out of state just because of healthcare coverage. There are options out there, and while direct primary care is not an insurance plan by any means, you still need some major medical plan to cover for catastrophes and emergencies. There are other ways if you shift your paradigm and thinking about how you pay for healthcare, you really can save a lot of money and can give you a lot of choices.
Yeah, I think that's great.
Yes, we're here for you. Health and Healing Direct Primary Care. Dr. Aimee Ostick.
Dr. Brian Ostick.
818-600-2426, or you can visit us at www.healthandhealingdpc.com or www.hhdpc.net. Thanks, guys. Happy Friday. Take care of yourself.
Enjoy your weekend. Wash your hands.